why we do dexamethasone suppression test. What is the difference between high dose versus low dose dexamethasone suppression test? That is the key learning objective in this 19th edition of the InstaLecture. Now, if you need to answer this question, that what is the key difference between high dose versus low dose dexamethasone suppression test, the answer in a single line or within 30 seconds would be that low dose dexamethasone suppression test is primarily used as a screening test for Cushing syndrome. That means we want to know that this patient is having Cushing syndrome or not. That is the basic purpose. And on the other side, on the contrary, the high dose dexamethasone suppression test, if it is used, the primary use is not for screening for Cushing syndrome, rather to find out the exact etiology, the exact cause of Cushing syndrome, primarily to differentiate various causes between ACTH dependent Cushing syndrome. I think you already have this basic idea that what are the common causes of the Cushing syndrome. It could be due to exogenous administration, or it could be due to a pituitary tumor, pituitary adenoma. It could be due to an adrenal tumor, which is releasing ACTH, or it could be due to some ectopic ACTH secretion. So primarily these causes can be differentiated by using high dose dexamethasone suppression test. So to discuss these few key concepts, I have prepared a PowerPoint, and let us go through that PowerPoint to discuss this. So now I think you can see on the screen the PowerPoint, and that is the objective of this 19th InstaLecture, to know about the differentiate between the low dose dexamethasone versus high dose dexamethasone suppression test. And this is the 19th edition of the InstaLecture. Now, why the low dose dexamethasone suppression tests are used? It's used, as I mentioned earlier, it is used for screening for Cushing syndrome, to differentiate patients of Cushing syndrome from patients who do not have Cushing syndrome. To understand this even better, let us try to understand. It's usually done using 1 mg Cushing syndrome. So to understand this better, let us go to the whiteboard to understand a few basic concepts. So we know about the basic adrenal axis, that at the top there is hypothalamus H. Then it controls or is connected with anterior pituitary. AP, I'm writing anterior pituitary. And then it's connected with AC, which is adrenal cortex. Now, what's happening in a case of, normally what happens that if you have your cortisol levels are high, that would give a negative feedback to your anterior pituitary, also to your hypothalamus. Because hypothalamus releases corticotrophin releasing hormone to stimulate anterior pituitary. Anterior pituitary then release ACTH to stimulate adrenal cortex. This is the usual pathway. Now, when we are doing the low dose dexamethasone suppression test, which is using 1 mg dexamethasone actually. So this 1 mg dexamethasone in a patient with Cushing syndrome, who is already having a high state of cortisol, it would not affect much because he's already having too much of cortisol. So just adding 1 milligram more, it would not change this axis much. So in a normal patient, in a normal person, if I give him or her 1 milligram of dexamethasone, that would create a negative feedback on anterior pituitary and the hypothalamus, causing depression or suppression of the cortisol level. But if a patient is in a state of hypercortisolism, chronic state of hypercortisolism, that means he's already having a high state level of cortisol, that is, he's having Cushing syndrome, then there would be not much effect on this feedback by this low dose dexamethasone. So in a normal person, what do you expect if I give him 1 mg overnight dexamethasone, that his or her serum cortisol level would be decreased. But if that decrease does not happen, then it is suggestive of, it's a screening test is suggestive of in an appropriate patient for Cushing syndrome. But Cushing syndrome screening always usually not done on the basis of this low-dose dexamethasone suppression test. We also do some other frontline test, common test, like late night serum cortisol level, late night serum cortisol level, urinary cortisol levels. You can check. So all these things usually they are done. This is not an entirely based on this test. Usually there are two common tests which need to be done, which should be positive. But again, I'm coming back because the topic, the discussion topic is today on low versus high dose. So low dose dexamethasone suppression test. The idea is this: that there is a hierarchy. There's a loop there actually. There's a there is hypothalamus, anterior pituitary, and adrenal cortex. And adrenal cortex, the cortisol can inhibit, higher cortisol can inhibit the anterior pituitary and the hypothalamus. So if a normal person is given 1 milligram or low dose dexamethasone, there should be supposed to be a suppression of hypothalamus anterior pituitary, resulting in suppression of his cortisol level. But that would not happen in a patient of Cushing syndrome. That's the basic idea. So now the other thing, that when I'm given high dose dexamethasone, what is the difference in that? High dose dexamethasone, the idea is this, that if I give him higher dose of dexamethasone, then if the source of the ACTH is from anterior pituitary, then it is expected that there will be negative feedback, because this is quite high dose, 8 milligram. And then ACTH level is supposed to be decreased, and that could cause decrease in the cortisol level also. So if I give them high dose dexamethasone, 8 milligram, and then there is suppression occurs, then it is suggestive of pituitary origin Cushing syndrome, which is usually called Cushing disease, because if a pituitary origin, pituitary adenoma causing Cushing syndrome, we call it Cushing disease. But if the other sources of ACTH, like ectopic ACTH source from a lungs tumor, that is stimulating, that is causing the Cushing syndrome, exogenous source or ectopic source ACTH, that would not be suppressed by even with the high dose. This high dose dexamethasone suppression. So this is the basic idea actually, that usually the low dose one is used as a screening, and the high dose one is to find out the exact cause, find out the exact cause of ACTH dependent Cushing syndrome, that what is the source of that ACTH, that could be helpful. Now I think we can again go back to the PowerPoint which we are discussing. To summarize the key concept, which we know, that this is the low dose dexamethasone suppression test we mentioned, and the high dose are not used for screening for Cushing syndrome, but to find out the exact etiology of the Cushing syndrome. And high dose ACTH syndrome particularly is used for the differential diagnosis of ACTH dependent Cushing syndrome. That means if that Cushing syndrome is due to high ACTH production, then what is the source of that high ACTH? Is it originating from the pituitary, anterior pituitary, or it is from an ectopic ACTH source? It may be a lung tumor like small cell carcinoma. We can differentiate that using this high dose ACTH. But this high dose ACTH, I would like to mention that currently it is not the most preferred method to differentiate ACTH dependent, because there is one inferior petrosal sinus sampling. If it is there, this method is there, it is far better, is considered. But if it is not available, then we can use this high dose dexamethasone suppression test. And what is the objective? What is the idea? What is the concept behind the high dose dexamethasone suppression test? I have put it there. That usually when we add a low dose dexamethasone suppression test, that is supposed not to do any alteration in a patient with Cushing syndrome. But if we give them a very high dose, 4 to 8 times high dose, that is seen that ACTH secretion may be suppressed partially in patient with Cushing disease. Cushing disease means Cushing syndrome, which is due to a pituitary adenoma. But if the ectopic ACTH secreting tumors that is causing Cushing syndrome, they are typically not responsive to this high dose dexamethasone suppression test. So that was in a nutshell, actually, the topic which we discussed today, that what is the difference between high dose and the low dose dexamethasone test. In a nutshell, that low dose dexamethasone test is a screening test for Cushing syndrome to know that this patient is truly having Cushing syndrome or not. On the other side, the high dose dexamethasone test is basically used to differentiate the cause, to find out the exact cause of the Cushing syndrome, particularly to differentiate the exact cause of ACTH dependent Cushing syndrome, because ACTH dependent Cushing syndrome could be from a pituitary tumor or could be from some ectopic ACTH source. So that is the key differences between high dose and low dose dexamethasone tips in a nutshell. Thank you very much for attending this session.